with that. Now, it seems that every day we wake up to yet another health-related headline, often reporting conflicting and confusing advice.
But luckily for you, the GPs Dr. Chatterjee and Dr. Mansouri are on hand to offer second opinions. Very good to see you both. Where are we starting?
Well, we're going to start off with diabetes first of all. And actually, this is something that you've been looking into recently on your show, isn't it?
Yeah, absolutely, Holly. I think it's a very fascinating study that's basically saying that losing 1 gram of fat from your pancreas can reverse diabetes.
Right.
And I think it's more interesting for the scientists, really, that kind of study, because what are patients meant to do with that? I mean, how can you go to the gym and say, hey, I want to lose 1 gram from my pancreas? I think more importantly for me, it's basically just saying that type 2 diabetes is a condition that you can potentially reverse.
Yes.
And this is just adding weight to that. And that's something on the show that I've done, Doctor in the House, both in episode 1, but also tonight's episode, I've actually shown that you can actually reverse it quite
Well, a lot of
quickly.
GPs don't believe that, do they, Dr. Mona? Because they will say, yes, you can control it, but once you've got it, it's always going to be there.
I think historically that's the sort of the line that doctors probably would have taken, but we do know that there is more and more evidence to show that actually changing your lifestyle, reducing your carbohydrate, sugar intake, and losing weight does actually make a difference. And I've certainly had a few patients who have managed to reverse their diabetes.
Do you know what Doctor was just saying there, Dr. Rangan was saying there, that how do you say, oh, I specifically want to lose some fat from my pancreas? But surely there must be certain diets or certain ways of fasting that targets weight from, you know, inside the internal organs or something, as opposed to your cheeks.
Yeah. So go on.
I think probably not. It's not as straightforward as that. I think it's going to be a sort of holistic overall losing weight, because you put down fat all over when you have fat anywhere on your body. So even though you may not be able to see external fat, there will be fat laid down.
I'm thinking of something like the Atkins diet or whatever. Would it be more specifically?
Yeah, look, I think that's a really good point, Amy. I think one of the problems with the way we manage type 2 diabetes is we say, oh, you just got to lose weight and move a little bit more.
Yes.
And I think patients, they already know that.
Yeah.
I think the reality is, if you've got type 2 diabetes, or if you've got a bit of abdominal obesity, which is very common these days, ultimately your biology in your body has probably changed to the point where you don't manage carbohydrates very well.
Right.
And so if you reduce refined carbohydrates, and that really is even things that we call healthy, like toast and potatoes.
I was going to say, well, this leads us very nicely onto the next headline, which is too much bread and potatoes is a major cause of liver damage as it puts pressure on your liver, resulting in a non-alcoholic fatty liver disease.
Well, I think this is sort of news for the public in general, but I think something we've probably known for a while, that actually being overweight, being obese, and does actually have similar effects to taking too much alcohol in your diet. It causes changes in your liver. Your liver cells are replaced by fat cells, which then become fibrotic and don't work very much. So it's a real concern with the population that's getting fatter and fatter, unfortunately.
Yeah, and really bad news if you're Irish, I have to say as well, but these are staple diets. And it's true, we are now the fattest nation in Europe.
Really?
The Irish, yeah.
Really?
Absolutely.
Is that true?
Well, I just made it up.
No, I know, but you just wouldn't expect that.
There was a study earlier this year which said that. Yeah.
Eamon, do you not find it fascinating that actually toast and potatoes are things that generally people have thought are quite healthy for a while?
Yeah.
You know? I think that's what's really interesting about that, is that health foods that a lot of us are consuming, you know, toast for breakfast, you know, potatoes for lunch, actually could be driving liver problems. And I think that's really fascinating.
Well, let's move on to fertility now. More sex boosts men's fertility.
Well, I say this to my wife all the time, and I am glad this has been scientifically proven. It's not that I want to do this, but I need to do this.
It's good for you, quite right.
We used to say to our patients who were sort of trying to conceive and going through different forms of assisted fertility or assisted conception, that men should try and save up their sperm. But there's more and more evidence to show that actually not doing that and getting on with it is actually better in the long term.
Well, the study said 73 couples undergoing fertility treatment said sub-fertile men produced 2 sperm samples within 60 minutes, and when the second sample was used in the treatment, the pregnancy success rate was more than 3 times successful.
Yeah.
I mean, that's extraordinary. Again, opposite to everything we've ever been told.
Exactly, really fascinating. And then I guess it lends, it begs the question, what happens with the third sample or the fourth sample? Because obviously that hasn't been studied, but we don't know what the optimum amount is, but it certainly throws a bit of conventional advice on its head.
Look, there's 2 I want to fit in here quite quickly. In this party season, I think this is very, very important. This is vital. Can salami cure a hangover?
I'm not completely convinced by this. I think we were just touching on this a little bit earlier, that of course having something to eat and not drinking on an empty stomach is good. That's the stuff I think.
This is the actual one that
special
they're talking
salami
about
that's supposed to contain special ingredients that including chili and garlic. That's
Okay,
supposed
so the
to.
jury's out on that one.
Jury's out, yeah.
This anti-aging drug, you could live until the age of 120. Would you want to? Would you?
Yeah, of course.
Would you?
If you give me a pill now that said I could live to 120, I'd take it 100. Why wouldn't you?
If you're healthy.
If you're healthy, no, of course you would. Of course you would. And what is it? What is this
It's
pill?
a drug called metformin, which is actually, I know we've already spoken about it, but it's actually a drug we use to treat type 2 diabetes. So it's really fascinating that actually blood sugar not only drives diabetes, but in many ways drives our aging process as well. So actually a drug which helps diabetes is also helping to stop us aging. I think it's fascinating.
Well, thank you very much.